Can you tell us about your organisation Hepatos and the MOBHOPE project?
The Croatian Society for Liver Diseases Hepatos is a non-for-profit organization. Now, for more than 25 years, we have worked to improve the lives of people affected by viral hepatitis and other liver diseases. We support patients, work on stigma reduction, promote early diagnosis and timely treatment, and advocate for better liver health policies both in Croatia and at the European level. Nowadays, we are recognized for our Mobile InfoHep Centre. Started 10 years ago, through this fully equipped mobile clinic, we provide liver examination, hepatitis testing, counseling, and direct linkage to care with local specialists. Many marginalized and at-risk groups do not have easy access to specialized healthcare. That is why we go to them. We work in rural and remote areas. We visit small cities and islands, work with veterans organizations and centers, provide services in prisons, therapeutic communities, homeless shelters, and other settings where access to care is limited. Mobile units offer a cost-effective, flexible platform that complements national healthcare systems by reaching population who do not visit regular healthcare provider. They meet people where they are, on the streets, in shelters, in prisons, and offer rapid testing, liver exams in terms of elastography, counseling, and linkage to care. And yet, across Europe, these services are fragmented. No common standards, no shared framework, no coordinated efforts to scale up what we know that works well. This is where MOBHOPE comes in. MOBHOPE stands for Mobile Hepatitis Outreach and Prevention Effort. Project started in 2025, in November 2025, and is an EU co-funded under the EU for Health program. It brings together 3 partners from Croatia, Portugal, and Spain. The 3 mobile clinics have all been included in the compendium of good practices for the health sector response to viral hepatitis gathered by the WHO Euro. These models combine their expertise into one strong alliance and together offer strong research, field experience, and patient advocacy. Basically, MOBHOPE is the mechanism aiming to standardize, strengthen, and adapt these approaches into a shared European model for mobile liver health services. In other words, by merging healthcare innovations with operational research, we aim to deliver a replicable blueprint for equitable patient-centered liver care. Our shared goal is simple yet ambitious: standardize, optimize, and expand mobile healthcare delivery for viral hepatitis and other liver diseases across Europe. The overall objective is to reduce the burden of viral hepatitis and related liver disease among vulnerable populations in Europe by improving and harmonizing mobile liver health services across countries. For us, MOBHOPE is a natural continuation of our work, bringing healthcare into communities.
How do EU-funded projects like this help address the health needs of underserved populations?
EU-funded projects like MOBHOPE are extremely important. They help address health inequalities in a structured and sustainable way. Many people at highest risk of viral hepatitis and liver diseases face serious barriers. Some lack information or health literacy. Some experience stigma or discrimination. Others live in poverty, unstable housing, or remote areas such as islands or rural regions far from specialized healthcare services. Traditional healthcare systems do not always reach this group, but mobile clinics can. Mobile services bring testing, counseling, point-of-care diagnostics, and linkage to care directly into community settings, places where people feel safe and comfortable. We also see this very clearly through our work with the EASL Impact project. We are proud to join European Association for the Study of the Liver on this project, which is also very well known as Love Your Liver. Together, we bring liver health directly to the public. Great example of this were free liver health checks and awareness activities during the EASL Congress 2025 in Amsterdam. What we saw there was powerful. The response was remarkable. Many people came forward to get examined. Many had never been tested before. Some had never thought about their liver health at all. This shows something very important. People are willing to engage and want to know their health status. But many do not like to use traditional healthcare services, and we need to understand why. It also confirms that mobile, accessible, and stigma-free services are part of the solution. EU funding makes this possible and sends a clear message. Healthcare should be proactive and inclusive.
In your opinion, what should the EU be prioritising to address viral hepatitis and liver disease across Europe?
I believe the EU should focus on three main points. These are essential to achieve the WHO goal of eliminating viral hepatitis by 2030 and to improve liver health across Europe. First, we need much wider screening and better awareness about benefits of early diagnosis. Viral hepatitis is preventable and curable. Many liver disease can be detected long before serious complications develop. Yet, millions of people in Europe still do not know they are living with hepatitis B or C and liver diseases. Many countries rely mainly on passive testing in clinics and GP offices. This approach misses people at highest risk. We need proactive case finding outside hospital walls, including community-based testing, mobile clinics, and outreach to marginalized populations. This is fully aligned with the conclusions of the EASL Lancet Commission on Liver Health, which calls for a shift from late-stage treatment to prevention and early diagnosis. Second, we need stronger linkage to care pathways. Testing alone is not enough. People who test positive must be supported to access specialist care and timely treatment. Mobile units and community organizations play a crucial role here and should be formally recognized and supported. And third, we must address the social factors of liver health. This includes stigma, discrimination, and lack of information. Fear of judgment still keeps many people away from testing and treatment. The EU should invest in awareness campaign, professional training, and culturally sensitive community-based approaches. If Europe continues to support community-based solutions, innovative diagnostics, and cross-country cooperation, hepatitis elimination, and liver diseases reduction is achievable. But it requires political will, long-term funding, and a clear commitment to liver health as a public health priority across all EU member states.